Many people use artificial sweeteners in their coffee or teas or are opting for diet drinks to avoid sugar. But a new study is looking at the impact of those sweeteners on a person's health, specifically when it comes to the brain. For more, I want to bring in our CTV medical expert, Dr. Marla Shapiro. Dr. Marla, thank you as always for joining us. Good to see you back. Let's talk about this. What did the study look at?
So this was a longitudinal study. So longitudinal studies look at large numbers of individuals over decades, accumulating multiple areas of data on chronic disease, as well as, in this particular case, the use of sweeteners and the association with premature decline in terms of cognitive function. So things like executive function or things like verbal fluency, which we can test for on different types of surveys that we do. And strikingly, what was found was that the higher consumption of sweeteners was associated with dementia. So we looked at our highest tier, 191 milligrams of sweetener. What does that mean? That's about 1 can of diet pop. You're getting it in one fell swoop.
I know when I looked at that number, I went, that's a big number. Then you said
it's not.
Can.
No, it's not. And then you look at 66 milligrams and then the lowest tier. But the higher the tier that you used, the greater cognitive decline that you saw. And the type of cognitive decline that you saw was typically seen in individuals under the age of 60 with use or diabetics. And interestingly enough, the use of sweeteners predisposes you towards diabetes. So if you were in the highest tier, you had a 62% faster rate of global decline. In that middle tier, 35%. So you're really looking at 1.6 years earlier of cognitive decline in that high group. But again, that high group is someone who has a can of Diet Pop every day. And a lot of Diet Pop users will have multiple cans over the course of the day. The middle tier was about 1.3 years. So really quite startling. And when we looked at the type of sweeteners that were studied, there's the list in front of you. A lot of those look very familiar to you. You see them, those, if you read the labels and what it's sweetened with, it may differ if you're in Canada or the US and Europe, but you'll typically see these are the artificial sweeteners that are used.
And a study like this is far more conclusive, isn't it? Because it's looked at long term.
Well, it's observational, so cause and effect is always difficult to determine. Like, what would be the cause and effect here? Is it the impact on metabolism? We do know that artificial sweeteners do have that link with risk of diabetes, so something is happening in the metabolic pathway. So while we clearly can't say cause and effect, when you look at large numbers over a long period of time, then that type of observational outcome where clearly those with a dose-dependent exposure had higher rates of cognitive decline, it opens up the door for more research. And certainly, as a physician, may have you say to individuals, think about what you're consuming, because the consumption itself has an impact. And here we're looking at premature cognitive decline.
And so many people, when they look at it, they're thinking, well, we're not doing sugar because sugar's bad. But now you have to think about how much you have. What are some of the other takeaways from this? I
think the takeaway is that, as we see in many of the studies that you and I look at, whether we're looking at sweeteners or whether we're looking at foods that are smoked or prepared, we see that what we consume has an impact on our health. And here we're beginning to understand that what happens in our vascular, for example, around heart, happens in the brain as well. So here you're seeing really something that you can do in terms of exercise and lifestyle we always talk about, but now diet, although it sounds like, low calorie, no calorie, oh, that sounds like a sure win thing to me, it may have repercussions that you can avoid.
Okay. I always love talking to you, Dr. Marla. Thank you as always. CTV's medical expert, Dr. Marla Shapiro.